Hey everyone, happy Monday. Welcome back to another episode of the Dental Download podcast. So today we are joined by a guest. Dr. Ivey is an orthodontics resident student, and she talks a ton about applying to orthodontics residency, the difference between match and non-match programs, what you need to be doing in dental school to prepare yourself to apply and be a competitive applicant. She talks about her experience at her program and also kind of her route just in dentistry in general, how she decided dentistry, how she decided orthodontics. So I think this will be a really cool episode for everyone to listen to, but we're just going to do a quick little intro and then we will get right into that conversation with Dr. Ivey. So I'm actually recording this intro a little bit earlier than I usually do in the week. It's Tuesday right now, so little less than a week till this episode is going up, but I have some interesting developments in my schedule. So we have canceled our sim lab actually for the next 2 weeks because there was a couple COVID cases and they just wanted to be very precautionary, which I really appreciate. So they canceled in-person pre-clinic. Our clinics are still open, but the pre-clinics are canceled for 2 weeks, and then that leaves like 3 or 4 days before Thanksgiving. So I'm not sure if they're going to have us come in and try to complete our practical that was supposed to be this week and also try to complete our remediations that were supposed to be the following week, or if it's just going to be optional practice time, or if it will be optional, you can do the practical, or we can wait till next semester. So TBD on that. We will have updates in future episodes, I'm sure. But I also am headed home actually today, back to my parents' house, and then I am joining them in Florida next week because I didn't want to be alone at my apartment. My roommate went home as well because haven't been exposed to anything. So I just figured that I didn't want to be here alone, quite frankly, because we're not really supposed to be seeing classmates at anything, obviously, with us being closed down. Some students are in a voluntary quarantine, and then the rest of us are just supposed to limit our social interactions and everything. So I'm just going to go with my parents down to Florida for a week and complete my schoolwork from there because I need to be around some people, and family is a-okay on my terms. So that's the major sim lab developments, that there won't really be much going on for sim lab because we are out of there for a couple weeks. But we do still have all of our didactic courses in full swing. We have a few more exams coming up before we start finals, which are kind of the couple weeks after Thanksgiving. My last one's December 17th. So they're spaced out quite a bit. We have them over the course of, I think, 2.5 weeks. So thankfully there's not really 2 exams in one day or anything, which is really nice. But we have a few more exams before we transition into finals. But some of the content we're learning now is actually for our finals, and it's just going to be spread out throughout Thanksgiving and then tested early right after that. And then some of the content we're learning for one more exam, and then we have another unit that's going to be finals. So that's kind of the breakdown of what school is looking like right now for us, but basically just very bookwork now that all of our hands-on activities are paused. And then for this week's motivation, I just wanted to, again, mention the idea of writing out your why dentistry. I think it's so useful to go back and look at that, whether you write it on a sticky note, whether you write a whole letter to yourself, whether you type it in your notes app in a Google Doc or something, email it to yourself, whatever is a good format for you to be most impactful. But writing out your why dentistry and reflecting on that as we're going into more midterms and into final season, especially if you are a pre-dental student or even a dental student and really struggling to find that motivation, if you're just buried in the bookwork and not interacting with patients like you want, not getting hands-on work like you really want to be doing. Writing that out and reflecting on that and reminding yourself of why you're doing all the hard work that you're doing could really help boost your mood and boost your motivation going into your next season of exams. So I encourage you and challenge you to try that out and let me know how it goes for you. And with all of that said for our little introduction, I will pass it over to our conversation with Dr. Ivey. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Hi, everyone. So today we do have another guest, and I'm going to let her introduce herself.
Hi, everyone. I'm Elizabeth Ivey. Thanks for having me today. So I went to the University of Louisville School of Dentistry from 2014 to 2018. I graduated in May of 2018 and then went straight into my ortho residency. So I'm at St. Louis University right now. It's a 2.5-year program, and I'm finishing up in December. So I'm almost out in the real world.
So just for people that aren't familiar, and even I'm not that familiar, are all ortho residency programs the same amount of time, or do they differ?
Nope. So they differ. There's 2-year programs, there's 2.5, and there's 3-year programs. So for example, the University of Louisville Ortho is a 2-year program, and St. Louis is 2.5. And then I believe like Nova and San Antonio are 3 years. So they fall between 2 to 3 years, depending on where you go.
Got it. So since we're already talking about like residencies and maybe picking a program to apply to, could you walk through the steps that someone would follow if they're interested in applying for an ortho residency?
Of course. So applying for ortho really begins when you start dental school, and that's something I don't think people realize. If you even have a 1% chance thought that you might want to specialize, when you go into dental school, you want to have that mentality. So starting good grades from your first year and maintaining those throughout your couple years is very important. That's one of the main things that ortho schools look at on an application. So generally top 10% of your class is what they're looking for. Now, if you're less than top 10% or above, so if you're like 25% of your class, that doesn't exclude you from doing ortho, but you need to have other things really well-rounded. So that's the biggest thing, is starting with your grades. You also have to do several checkpoints when you're applying. For example, you have to have some shadowing hours, just for experience more than anything when you're answering interview questions. You also have to take the GRE, and that's usually your 3rd year of dental school. So you'll take the GRE. It's kind of a baseline checkpoint that schools want to have checked off. There are some schools like Iowa that rank your GRE scores pretty heavily in your application. So that's something you want to look at on their website, talk to residents, and really, depending on where you want to apply, it's going to vary your application process just a little bit and your resume. Some schools also require the ADAT. It's a test that is relatively new in the past 5 years, and it's been regressing a little bit too. So not a whole lot of schools require it, but like I said, it's one of those check mark things just to put on the list. Usually you take that about beginning of your 3rd year of dental school. And then, if you know you're going to apply to especially ortho, whatever, you also want to build your extracurricular activities all years. So you don't want to be involved in 40 different things. I would say my biggest piece of advice is pick 2 or 3 that you're super interested in and build those, because when you go to interviews, people are going to love saying something that you know a whole lot about, are super interested in, can carry on a conversation about. So you, like, for example, I loved being a part of the Special Olympics. So I went to every Special Olympics event, did dental screenings, made mouth guards, and I was able to talk about that in interviews and why it's important. So that kind of was a great thing for my application. Also, if you're applying to ortho, you will need letters of recommendation. And I imagine most specialties are like this. But some schools require 2, some schools require 3, and some 4. And usually it's faculty. So you'll have 2 faculty members and either 1 orthodontist or 2 orthodontists for resume. So it's really, really important if you're applying to ortho or any specialty, not only to maintain your grades from the first part of dental school, but also to make those connections with orthodontists in the dental school or in the community that can write those letters of recommendation for you. So that's kind of applying. And then once you get there, you'll apply between your 3rd and 4th year of dental school. So it's usually in the summer. And then you get interviews anywhere from September to November. And then match is the end of November. So for people who don't know anything about the match program, this was super confusing to me. Do you want me to just go ahead and explain this now?
Yeah, please. Thank you.
Okay. So match program, schools are either match or non-match. So match is done by medical schools, dental schools, and basically you go and interview at these schools. So they'll send you an invitation to interview. And then you rank your schools on the program, the match program's website. And you say, I liked St. Louis University number 1. And I liked University of Louisville number 2. And you keep going down at however many you interview at. So you could rank, if you interview at 3 places, you'll rank 3 places. If you interview at 10, you can rank 10. And then the schools will also rank everybody who interviewed there. So, for example, St. Louis might have said that they liked me, number 1. And as long as I'm kind of within the top, I rank them number 1, they rank me number 1, the top couple matches, the match program will put you into that program. So the match program is designed to match as many residents to as many residencies as possible. It works in your favor. So it's kind of confusing because you don't know where you're going to go. Whereas when you apply to dental school, you get to pick. If you get accepted to 10 places, you pick which one you want to go to. Whereas match, they tell you which one you go to. So you can rank, but that doesn't mean you're going to get your top spot. So it's a little bit confusing. And then there's the non-match programs. Non-match programs will send you an interview date. You'll go and interview, and it's usually before any of the match program dates. So you'll interview August, September, before that normal September to November interview date for matches. So you'll interview early, and then you usually have 24 hours to 48 hours to accept their invitation to go there. So they'll interview you, and then the next day they'll call you and they'll say, we want you to come here. You have 24 to 48 hours to approve, and then you'll get accepted. And it's a little bit hard because those are done in the order that they invite you. So you might get like a school you kind of want to go to, interview you first, and then you don't know if anybody else is going to call you to interview for the non-match schools. So you have to either accept not knowing if you're going to get another interview or not. So it's kind of a little confusing. But you can either pick non-match schools to apply to, or you can pick match schools to apply to. But match programs will have you sign a waiver. It's an ethics waiver that says you are not applying to non-match schools as well. So you definitely want to divide yourself either into non-match schools or match schools.
Is there a difference in like accreditation or like reputation between match and non-match schools, or is it just kind of a preference of like specific programs that you're interested in?
It's just preference of programs. So
Okay.
For example, San Antonio has 4 spots for match and then 1 for non-match. So sometimes even programs separate spots.
Okay, yeah, that makes a lot of sense. Thank you for breaking that down. I'm sure it was really helpful for people,
Yeah,
especially me. I don't really know anything about specialties, so I appreciate that. So you mentioned even if you have like a 1% chance interest, it's good to start acting like you're for sure going to apply to residencies early on in dental school. That way you're prepared and have a good application and everything. But how did you decide that you wanted to go into orthodontics?
So actually, I did a little backwards because I wanted to do anything but dentistry. My sister is a general dentist, and she graduated from U of L School of Dentistry in 2013. And I've always kind of followed in her footsteps. So I told myself, I'm going to do something completely different than her. And I had braces in 7th grade, and my orthodontist is super great about talking about how ortho is such a great profession. And last year was the president of the American Association of Orthodontists. So it's Dr. Gary Inman. And he's always very good about talking about how it's a great lifestyle. And that's why my sister went into it. And so I was like, you know what? I know it's a good lifestyle, but I don't want to do that. So I shadowed in college anesthesiology, dermatology, psychology, pretty much any medical profession, and I hated all of them. So I went back to Dr. Inman, and I'm like, hey, can I just shadow a little bit here? And I fell in love with it again. So I was, I had a little bit of exposure to it when I was younger, but once I really got down to shadowing, I realized how much I did love it. And being like my sister wasn't a huge deal. She's a pretty great person, so.
So did you feel like once you got like the 1 or 2 ortho classes in dental school, did that like further solidify like, yes, this is super interesting to me? Or how did you throughout dental school kind of confirm that you wanted to apply for ortho programs?
Our dental school really didn't have a ton of ortho. So we had one ortho class, I think it was 2nd year. And it was basically just a little didactic, and we made a Holly and we made a quad helix, and I really didn't get a ton of that. So it was kind of on our own learning about ortho. So I went and shadowed in the ortho clinic when I could. I talked to ortho faculty. I did shadowing at, like I said, Dr. Inman's office, and really just going in and seeing that hands-on. The clinical part for me was when you see it in private practice, it's different than when you actually are doing it, I guess. So I always thought ortho was really easy and that it was just pretty simple. And that's what really got me interested in it, because the lifestyle of, if you go into any specialty program or dental clinic, it's not the same atmosphere as an ortho clinic. Everybody's really happy to be in there. And so once I really got up in there and shadowed and was around them, that's when I really decided that I loved ortho, and I loved the atmosphere, and I loved the challenge and the things that went beyond just the simple things I saw in clinic.
So it sounds like that would also be a good chance that you're making connections that could write strong letters of recommendation, like you mentioned. Is there anything else? You also mentioned Special Olympics. Anything else that you did in dental school that you think really prepared you to apply for your program?
The biggest thing I would say is we had a 4-week externship in your 3rd year of dental school. I don't know if a lot of other schools have that.
I think it's more common now, yeah.
Okay, good. And I don't know with COVID right now, I'm sure that's limiting people. But we could do our externship at an orthodontic office. So I spent 4 weeks as a orthodontic assistant, basically, for that externship. And that really just helped build my clinical skills. And before applying to ortho, it really helped solidify, the fact that I wanted to do ortho.
That's really great that you got to work hands-on for so long in that setting. That's awesome.
Yeah, it was super fun.
So do you have any advice for a pre-dental student or maybe someone in dental school that knows they want to go beyond just doing general dentistry, but they don't know which specialty would be the best for them?
Yes. Like I said, I'll say it a lot. Shadowing, it really gets you in the clinic. It really lets you experience things. Talking to faculty, talking to people, you can talk to residents. The great thing about now is with Instagram and Facebook and podcasts, you can really hear residents' points of view. And I think that's super important because a lot of people, once they're out in practice, are kind of in that. And of course, they're not going to tell you any differently, but it's good to hear residents' point of view. So if you're trying to decide what specialty you want to go to, if you don't know, you can also think about doing a GPR for a year, so a general practice residency. And that way you get exposure to ortho, you get exposure to endo, you get exposure to oral surgery, to perio. And then that might even help you go into a specialty from there. You don't have to commit to one right away. So even if you're finished with dental school, you still don't have to commit. You can go back. And I think it's important to really be sure of yourself before you go into a specialty, rather than just doing it to do it, you know?
Yeah, I think that makes a lot of sense. And I've definitely heard of people that go to a general practice residency or even work as a general dentist for a few years and then go and specialize. I think you definitely wouldn't want to jump into it unless you're 100% sure. So that's really good advice. Now that we kind of got through what does it look like applying and some advice if you're on the fence, can you talk a little bit about your specific program? How do you like it? And like, what does a typical day look like for you during residency? I'm sure it's a little different now with COVID and everything.
It is. St. Louis is a little bit unique. We are not hooked to a dental school, so we have no dental school at all, which makes it a little bit different. We feel more like a private practice. The orthodontic part of St. Louis was established first, and then pedo opened up last year, endo a few years before, and perio as well. So we're slowly building, but ortho has been there for quite a while. But we are a 2.5-year program, so we're a little bit unique. On Mondays, we have lecture only, so we see no patients on Mondays. And then Tuesday through Friday, we see patients. So when you're a first-year student coming in, a lot of times you don't know anything about ortho. Like we only had that one ortho class. So you do a 2-week boot camp, and the boot camp goes through pretty much a crash course on how to tie a patient in, how to fit bands, how to fit headgear, what's a forceps, what's, all the different appliances and what to do in emergencies, and just little stuff too that, you just don't know. It's not hard, but you just need to kind of acclimate yourself with ortho. So we do the boot camp. For the first 2 weeks, you're not seeing any patients, but you're working on each other. So you're taking pictures on each other. You're taking impressions on each other, just to really get yourself comfortable. And I think that was such a huge relief for me, because while I've done a lot of these things in dental school, it's different when you're working with kids and when you're trying to get these really great photos to make sure you can diagnose the case correctly. I think that boot camp was awesome. So you spend 2 weeks in boot camp, and then after that, you go into clinic. So as second years and third years, you work up cases for the first year so that they have patients once they get into that third week in clinic, which is really great. So they're not having just downtime until they can work their patient base up. They've already got a little bit established at that point. So everybody has class on Mondays. As a first year, you have class your first semester from 8 to 7, which is a long day. But you're also getting your masters at our program. So those are those master classes that first semester. Then after the first semester, they go 8 to 4. And that's the same thing with the second year. You go 8 to 4. And then once you're a third year, you go 8 to 2. But we also have a break 11:30 to 1 for lunch. So it's not like it's a super long day. You have a little bit of time to go and have a good lunch and go outside and eat lunch with everybody or go pick up lunch. So it's a nice little break throughout the day.
Thanks for breaking that down. I really appreciate it. So you mentioned that most of the week, other than on Mondays, you are in clinic seeing patients. What's like the kind of range of cases that you see? Is it common, like just like braces and like headgear and things like you mentioned, or is it sometimes really like dramatic facial changes going on with cases, or does it vary?
It completely varies. We have pretty much everything. So we see kids anywhere from 7 to adults all the way up to, I think the oldest patient in our clinic is 78.
Wow.
So everybody, loves to get braces at whatever time is right for them in their life. So we do Invisalign cases. We do Sure Smile, which is also a clear aligner company. So we do Sure Smile. We're planning on integrating a third clear aligner company. And then we do braces. So we do ceramic braces, metal braces. And then I don't know if a lot of people are familiar with lingual braces. Those are on the, lingual side of your teeth. But they are only done at a few residencies across the nation. And that was one of the things I really liked about SLU is they offered lingual braces. And they're very difficult to do mechanically, but it's great to do in residency. So we do braces, and then we just got some 3D scanners. We have 2 iTeros, 2 Trio scanners. And that way we take digital impressions rather than alginate impressions, although we do those on occasion. And then we also treat in-house DIY aligners. So we just got 3D printers and we make our own aligners off of those. So, we do everything pretty much at St. Louis, which is really cool.
That is really cool. And you mentioned that getting to do the lingual braces is one of the reasons you picked St. Louis. Are there any other things? I know this is personal from person to person, but what were some of the factors you were looking at when you were choosing which programs you wanted to rank in your matching?
Yes. So I applied to about 22 schools. My husband was also applying the same cycle as I was. So we were hoping to match at the same time in the same place. So it kind of is a really unique situation. So in match, you can link your profile to someone else's. You don't have to be married. You can be dating. You can be siblings, whatever. But you link them together. So if you interview at the same place, he would rank his as St. Louis as number 1. I would rank St. Louis as number 1. And then if they don't like him at all, then it would rank him individually. So he would be separated from mine. So it doesn't hurt you to match yours together. But so we were trying to apply together. So we picked the bigger programs. So we applied to Marquette, to Temple, to San Antonio, like I said, has 5, to St. Louis with 14. So we were really picking the biggest ones that would accept both of us at the same time. So it's a really unique situation. But we also really wanted a program with awesome faculty. In dental school, I had great leaders in dental school, but they weren't always the nicest. So I wanted to be treated more like a colleague than just a student. So we would rank based on what we liked the best. So I felt like St. Louis had the faculty that just treated you super well. They were amazing. They were forward thinking. They were kind. So that's probably the biggest reason we picked SLU, besides the big class size. And then we also know that orthodontics is going digital, is going very technical. So we wanted to have a program that also thought the same way. So Dr. Kim at St. Louis, who's our program director, has implemented all of this technology since we've been there. We didn't have SureSmile. We didn't have clear aligners besides Invisalign. We're the first program to do direct print aligners in the world besides Korea. So, just all this technology is something that he told us when we interviewed there. And so we just really loved what SLU had to offer.
That's really great. And I honestly had heard about you could link up an application for matching, but I didn't know everything you said. So thank you for explaining that. I'm sure that's going to help a lot of people. So the next thing I wanted to talk about is there anything with your work so far that has surprised you, or maybe something that went differently than you were expecting?
Honestly, orthodontics in general kind of surprised me. Like I said, I thought it was going to be super easy and you can't mess anything up. In dental school, you always worry about extracting the wrong tooth or pulping a tooth. I'm like, ortho, you can't do anything bad. But then you get into ortho and you realize how complicated it is, and all the mechanics that go into it, and, root resorption, all these different things. So it really surprised me that there was so much more to ortho. People think it's boring and you can't think and there's nothing to really do, but every case is so different. Cases are challenging. They come in and you're missing 8 teeth, and you'll sit down and we'll have case conference, and case conferences where we all sit there and we go through a case and we talk about it, and every faculty member in there will treat that patient differently. So they'll say, close all the space. And the next one will say, you can't do that. And then the next one will say, well, we can do that, but here's the consequences. So it just really surprised me how many different ways you can treat something, and how difficult it is, and how your foundation of your knowledge affects how you can treat a case. I just always thought ortho was super simple. So I've been pleasantly surprised that every case is a new challenge and it's different. And every day you wake up, you're going to get something different in clinic, even with the same patients.
So that that's something I was expecting too. I thought that ortho would be more straightforward, but it sounds like there's many different approaches you could take. So I could imagine that might be stressful at times when you're trying to figure out the right treatment plan for a patient. Is there any I don't know, I think there's kind of maybe a misconception that once you start working on patients, whether it's the last couple of years of dental school or during residency, that life is a little less stressful than when you're hitting the books really hard. Do you feel that way, or do you feel there's still plenty of stress going along in your program?
There's always stress.
Yeah.
I think it's definitely less stressful than dental school. With all the studying and stuff, that was so much stress in dental school. There are days that are stressful, but for different reasons. You do worry about those negative consequences when you have a really difficult case, or you're just worried about a patient who had short roots to begin with. Your whole treatment, you're just worried about them. Even though they know and you told them, you're always just worried about what can go wrong. And yeah, treatment changes as you go. That's the great thing about ortho. You can change your treatment plan as you go based on, if something isn't going how you want it to go, you can reevaluate and do something better for the patient. So while there are stressful times, I think that ortho is really great because you can take that time to step back and reevaluate, and then kind of move forward and take a different direction so that everything works out well.
Yeah, that's really great. Is there anything particularly for you that you do to kind of relieve stress, or separate work from home life, or just how you get through overwhelming times?
Yeah, so there's a lot of days where clinic is overwhelming, and it's maybe not physically overwhelming, but mentally, emotionally, when you've got 4 patients there, or a patient shows up that didn't have an appointment and you're just trying to figure out what to do. There's always those times that those are overwhelming, but the most important thing is to realize that you're not alone. Everybody in your residency is going through it too. Everybody in ortho residencies is overwhelmed. So the biggest thing is to talk about it with other people, just blowing off some steam. I also love to work out and listen to music. So after school, my co-resident and I will go to the gym and we'll just work out for an hour or do a class and just listen to some music and really kind of separate ourselves. And then when we get home, I think it's also important not to stress yourself out. You have to remember that you're still a person. Dentistry is not your whole life. You have to separate that a little bit. And I think that's really difficult to do. But when you're feeling overwhelmed, you just have to realize it's not your whole life, and your patients will be okay, and you're helping them no matter what. So just, take some time for yourself, listen to some music, and do whatever makes you feel better. When you're overwhelmed, everybody's got a different way of coping, but make sure that even when you feel like you can't handle it, that there's someone going through it with you, and maybe you can talk with them and kind of blow off steam together.
That very nicely leads into our last question, which is, how do you think dentistry fits into your overall life goals?
Like I said, dentistry is not our whole life. We get so consumed with teeth. I think we're the only profession that, like, when you go out to a social event, all you talk about is teeth. Medical doctors don't talk about body parts all day. I don't know what it is about dentistry, but we get a little bit, caught up in teeth. So I think you need to realize that your whole life is not dentistry. You are a friend, you're a daughter, you're a wife, whatever you may be, you're still a person. So your overall life goal shouldn't be completely dentistry. You should also have personal goals. You should also have relationship goals. So in the long term, I'd like to own my own practice. I am going into a practice starting in December, but, my goal for dentistry is to have a practice and to work at that practice with my husband, and to maybe have a couple of practices, but also to just maintain a happy lifestyle. I want to be able to go to concerts, and I want to be able to have my workout time and go to happy hour with my friends. So I think it's important to kind of balance your life,
Yeah, 100% agree. I really, really like your answer. So do you have any closing advice at all for dental students? Any final thoughts you want to get out to the listeners?
My biggest piece of advice for applications or interviews, anything like that, is just be yourself. They know when you're just answering to answer in interviews or in your personal essay. They really want to hear about you. They're looking for those unique people to round out their resume or their program. Everybody has good grades that applies. Everybody has good scores. So the biggest thing is they want to see what makes you unique, and they want to have you in their program. So be yourself. And the thing about interviewing and residencies are, if you're not yourself, then you're going to be stuck in a place where you pretended to be someone else, and you might not like it. You're going to spend 2 to 3 years with these people all the time, every day, every single day, on the weekend, because you're most likely going to be away from home. So you want to fit in, and you want to love your residency. I absolutely love the people in my class. We're all very different. We have 7 international students. And at the end of the day, we all are ourselves and do our own things, but we also hang out together. So I think if I wouldn't have gone into interviews just really like being open and honest, then I wouldn't have found the best fit for me, because they want you to fit in, but you also want to enjoy your time there too. So just be yourself, and that way you'll find the perfect place to spend your residency.
I'm really happy to hear that you have had such a positive experience with your program, and I hope people will take your advice and try to follow it if they are applying to ortho residencies. So what is the best way for people to get in touch with you if they do have more questions? Should they reach out on Instagram?
Yes, Instagram's the best way. I'm Lipsticks and Orthodontics. and I reply to messages pretty quickly. So that's it. Yeah.
Okay, well, thank you so much for chatting today.
Of course. Thanks for having me.
All right, so that is the end of this episode with Dr. Ivey, and be sure to follow her Instagram if you want to see anything she's up to in her orthodontics residency or ask her any more questions. But next week we will have a partially solo episode, except I'm joined with another one of my classmates actually. Mitchell came on to help me talk about D1 hand skills, D1 sim lab, based on a request from you all for that to be an episode topic. So I thought that it would be better suited if I brought on someone else to share their experiences rather than just myself, because it's kind of a tricky topic to talk about in podcast format rather than visually showing you something. But if you're interested in what SimLab is like, make sure you check out my YouTube channel. It's just my name, Haley Schultz, because I film pretty much every day that I'm in SimLab what we're up to. So if you check out my vlogs, you'll see more hands-on and visually what we're up to in SimLab. But next week, we will be sharing all of our advice and tips for adjusting to SimLab, loop, some tips for pre-dental students, and also just really the mindset that you want to go into it with, and finally also how to work with different faculty in SimLab. So I think it's actually turned out to be a really helpful episode. We just finished recording that, so I'm excited for you all to hear that next week, and we will talk to you next Monday.